It's amazing. Yeah, we can add it as off to the side.
I'm excited, a little apprehensive, hoping that everything goes as planned and knowing that there's going to be lots of things that we can't even anticipate that are probably not going to go as planned, but I'm ready. It's time to just flip that switch.
Why don't we start with interfaces, because that's likely going to be the one that we have to make the biggest decision around. So
pretty exciting and a bit overwhelming. There's lots going on at the site. There's lots of preparation and activity to get ready for launch. And lots of issues that we're still working through, as you might expect with a big project like this. The next 24 hours are going to be pretty intense, but my background is a nurse and I worked critical care. It feels a little bit like running a busy ICU again, and lots of different moving parts and lots of different issues that you have to keep a finger on and make sure are heading in the right direction.
It's easier if you just type it in instead of search for it. So it'll be a little bit easier to find them all instead of having to scroll through everything.
This has been a culmination of many, many years of work. There's still lots of work to be done, but I think we're just feeling fantastic. Thanks to the whole team that's put this together. This is like introducing a new medication, a new treatment in the system that will revolutionize how we do things.
So at the simplest, for me, Connect Care is about three things. It's about improving the quality and safety of the care that we provide. It's about engaging patients more fully in the care that we provide. And it really is about improving coordination and communication across the continuum of care.
We'll see how things go. And what I'll probably do is I'll get that community team to come in tomorrow.
I will just start off by saying that I am not super tech savvy. You know, I'm generally a late adopter when it comes to tech, but this to me is something different. This is about looking after the patient and having the patient's journey being available to us from start to finish.
What's happening right now is we're reconciling the census. There's 4 patients that were in ED inpatients.
Okay.
Now we got to find a home for them.
It has been a long time coming. It's a pretty intense project. So we have worked with over 5,000 clinicians from lots of different care settings, lots of different places across the province to design and build both the workflows and the clinical content that make up the system. Between the building and the testing and all of the clinical validation of really every piece of the system, it has been quite an intense journey. And so I've been checking in on all the teams. They are pumped. They have worked so hard to get here. There's been they've done something like 14 or 15,000 tasks to get us here. There's 90 people on this call getting ready to reconnect everything that needs to be reconnected.
I guess I'm part of the Chief Medical Information Office team. There's still issues. I don't mean to say that it's not rocky. You know, we're going up a hill here, right? Like it's not, we're not downhill. But overall, people are optimistic. They're willing to learn. They're coming and asking questions, and that's great.
That's going to be all our patients now. Right now it looks really overwhelming because there's a lot. And then rapid rounds will be what the charge nurses use.
I think it was a long time coming. I think that it probably should have came out a while ago. We're in the 21st century, so everything is on computer. There's definitely going to be some glitches that we need to work out, but yeah, I'm excited for it.
We're almost there. just trying to think, how is this going to all play out? Is everyone going to be feeling ready, and is the plan going to come to fruition? Fingers crossed.
Right now, I'm very confident. Yeah, we're progressing well with cutover. The teams are doing extremely well, and the issues that are, last minute issues that are cropping up are not. We have to work them through, but there's nothing that we're saying right now would block us from launching.
Hey. Hi. How you doing?
Thank you.
Are you ready? So you're close to the Pyxis, so I'm just thinking about our downtime.
Okay.
They're gonna shut the machine down for probably 30 minutes. Okay. Someone from pharmacy will come and do a check.
They tried their best to not schedule any elective surgeries and stuff leading up to this. Things seem to be okay. A few little hiccups in terms of things not being cut over into the new system like we had hoped, but we did kind of anticipate that. Won't you be excited to not have to flip through these charts?
I know, right? Thank you.
So those are the two forms. So far I'd say it's like as expected. So fingers crossed, in half an hour I'll be able to say the same thing.
This is going to be the best thing that's ever happened to Alberta. To have the continuity of care and the care and quality that'll be able through Connect Care is just fantastic.
Hey, here we go.
5, 4, 3, 2, 1.
Even that medication, I just gave that through the Connect Care system, and that was quite easy. That worked out well. So one down and thousands to go.
Hey guys, how's it going? And have you been able to get the data to stream? Oh, it looks like you have. We have flipped the switch and it seems to be working. Patients have populated in the system. Right now, everybody's just madly trying to look and make sure that everything is correct in terms of the orders that are entered and trying to log in their 4 o'clock vitals and their assessments. Vitals don't seem to be streaming from the monitor. Have you heard anybody else say that? Well, they're just starting to look at it down here. Few little glitches. Right now it's hard to know, is it the system that is the glitch or is it the user just knowing where to go and how to enter things. So just trying to just put out fires as we can right now.
I just made a note to discontinue after 2 hours, right? So yeah. So I'm told that I put the first admission order in to the hospital using Connect Care, although I don't know if that's confirmed. But I'm told 4:31 minutes after lunch.
I think it was us, according to the bed coordinator as well.
Okay. Well, apparently we are number one. Me and Jesse over here.
What you can do is you can reconcile it through, so if you say go reconcile.
The actual orders and going through all of that, it was simple. It was exactly as we had been trained to do. We actually followed up with the nursing staff, and it was also their first orders that they had to process for an admission. So that part went fine, as expected.
So it's going well overall, which we expected because of the planning that we had. We are certainly running into issues that we expected, but we are addressing them.
So I have to redo it, but I don't have any other options.
Okay, well that's another problem. Do you know anything about that one?
What do you mean? Those teams of people who we created to respond to that are doing their jobs, and that's really the story of this implementation so far.
There are 48 tickets left in VFire, but only a few related to the CMI roles.
Wave 1 will have a lot of work to make sure we're working through the issues and working through working with them, helping the system get stronger and stronger as we all learn together.
Do I scan all 3 vials and this?
Yes. So far so good. There are definitely some glitches. Pending workflows aren't working well for medication administration. We're still able to give the meds, but just not in the system the way we'd hoped. Everything's still okay? Okay, perfect. All right. The nurses are catching on really fast, and so far the attitudes are still really positive. There's a lot more work to be done. Now we can really get into the system and find out what's working and what's not, and what our next steps are.
We're coming on the air at this hour with breaking news.
A World Health Organization expert says it is impossible to tell when the Wuhan coronavirus will peak.
This now makes the first coronavirus death confirmed in the U.S.
Today, I'm here to announce that the first presumptive case of COVID-19 has been detected in Alberta.
Well, it's been quite the year. I don't know that any of us could have anticipated that we'd have a global pandemic come right on the heels of our Connect Care Go Live, but that is what has happened. So we've had some challenges for sure, but all in all, the Connect Care system has served us well.
There's lots of examples of how Connect Care has been a really effective tool to support the pandemic and the COVID response. We rapidly deployed some virtual health tools so people could stay connected to patients and families in their homes, both through virtual visits as well as the hospital at home technology, so they could monitor people more closely in their homes.
And the nice way that I can see that the system is so beautiful, I can literally hover and it will instantly log me into NetCare.
It's been a year of definite continuous learning for Walter Mackenzie, but also for our ambulatory sites in the Edmonton zone, lab services, and our Connect Care partners. We've all worked together really closely in the stabilization phase to make improvements, and I think no one would want to go back to paper-based systems. Staff and our physicians definitely talk about how comprehensive the medical record is and the real-time data and the ability to do quick links to NetCare, the ability to see the patient's entire journey from ambulatory to within the hospital. And I think all I would say is we're really looking forward to other hospitals and the community in joining us.
I had physicians spontaneously coming up to me and saying, actually, this system's working really well. I've found ways to make myself more efficient. I'm doing things in a more timely manner. Definitely there have been some challenges, but as we've worked with people through their challenges, they found ways to adapt the system and make it work for their workflows.
Well, you know, as predicted, it's been an incredible tool for us to do our clinical work. Certainly from my personal practice point of view, it's facilitated my rounds. I actually spend less time documenting than I did before, and they're more thorough, which is, you know, I think really valuable.
It lets me communicate with my different doctors, and I really feel that it's allowed me to be an advocate for myself in the healthcare system. I can see my results of my different various tests.
After the initial challenges immediately, that we discovered immediately post-launch or through launch. We worked on a lot of those with the clinical and operations leaders to slowly improve the system and how it's functioning. And we're starting to see, signs of much improved adoption and efficiency with end users.
It's a lot of work, but it is worth it at the end. Your hard work will be rewarded, and just to persevere. There will be challenges along the way, and the system isn't going to work perfect right out the gates. But as you come to understand how the system works and we find efficiencies within the system, I think that they will find that it really does improve their patient care.
Together, we do amazing things every day.